Now, our next contestant is Daniel Fallscheer from Das Lab. And I'm pretty sure with that name as a company, you've had a busy last 18 months. So welcome on stage, Daniel.
Thank you. Yeah, thank you. So the last, maybe not 18 months, the last 12, 13 months were pretty busy since foundation in September, as you can imagine. These are not my slides at the moment. But I can go without the slides. Maybe you find the slides somewhere else. So what we are building from Das Lab is a digital lab test infrastructure for the European ecosystem. And we heard quite a lot today, questions from AWS, also from the health insurances, is that relevant? Oh, I think that is, application of fire standards, loggings and nomads, I think it's pretty challenging still. So if we go to our vision, we want to make patients healthier by providing universal access to highest quality of diagnostics. And the mission is that we want to be the #1 vendor-neutral provider of testing in Europe by 2025. So you see already, it's not just a German thing. We are live in Germany, we are live in Spain. Many people may question why Spain. Spain is highly attractive. We could talk about an hour about Spain now, but Spain is really an interesting market. If you look at the global market, do you think it's a problem? Is the market big enough? How many medical decisions require diagnostics? We have many doctors in the room. Guessing, percent, how much? Any guessing? 20, 40, 70? Is there a majority somewhere? So it's 70%. And the market is pretty big. And just the market that we are addressing right now at the moment is 2 billion. But that's just starting, and that's just Europe at the moment. So this is a big market that we are addressing. If you look at the pain, why is it relevant to build an infrastructure? All what we heard today, it was about interoperability, it's about an ecosystem, it's about connectedness, it's about standards. We don't have standards. We think we don't have. We have FHIR, we have LOINC, we have SNOMED. Simply they're not used. So if you, for example, as a telehealth provider, want to connect to a lab testing infrastructure in a full country, well, lucky you, you can try that. It's horrible, it's not scalable, it's not really working that well. So it's also what we see still a lot of paper out there. It's pretty outdated systems. If you go deep into lab information systems, they're still sometimes really 20 years old. It's pretty tough to integrate. We found 6, 7 ways to integrate with list systems. I think we are pretty fast on that one now. And we are mapping them to our standards. So we are mapping them to FHIR, to LOINC, and to SNOMED. And this is basically where you can very easily plug in with us. It's a very simple plug-in solution. We are connecting in Europe, first of all, German and Spanish markets. But definitely we have at the moment like 50 opportunities on the table just in those 2 countries, so you realize the need is pretty big and we have to focus. We are live already, so as Dominic said, COVID was an accelerator that helped us. So we generated already quite a substantial revenue, 100,000 of tests run via our systems. So I think we're pretty well on the way. Team is 30 people, so it's not small. And the next use cases that are on the horizon is definitely more in the mHealth sector, it's more in telemedicine, it's more in the symptom checking, but we had the largest European private hospital chain also already reaching out to us, so it seems like there's a market. If we look at the team, this is just, so to say, the founder team. We have also very many industry experts, a very prominent senior advisory board out there of 9 people, many former C-suite members of lab testing, diagnostics, or telemedicine providers. And that's basically it. This is not my quote, this is just from investors. Let's maybe go over that, but the good summary is, Das Lab is the strive for diagnostics. Maybe you forget about the second one, but in a way we love it. It was from an investor, it was real. Thank you.